Welcome back to Pain Diaries. I am excited to reintroduce Jim LaValle, who is with us today on our show here in Houston, Texas. We are going to talk now about one of my favorite subjects, peptides, and I know it's one of his as well. So welcome back, Jim.
Oh, good to be back. And yes, it is a favorite.
So tell me why it's your favorite. What do you love about peptides?
Wow. I just wrote a book on peptides, which I was pretty happy to get that out. And I'll tell you what, it was the journey. My real first exposure was about 8.5 years ago. My son was an all-state football player and track athlete in California. He actually, and he had got a Liz Frank injury. So Liz Frank, second round of the playoffs, his senior year in football, he had already signed his Division I scholarship. And Liz Frank surgeries are, it was a significant one. It was going to require a surgery, but I used peptides, which were for inflammation. And literally, by the time we did the MRIs on him, it took 6 different sets of images to find where the tear was because the inflammation had gotten out of the tissue so much, which is unheard of. And then through that procedure, he had no swelling, which they get sausage foot after a peptide surgery, right? Sausage foot, big inflammation, not even the slightest inflammation by using peptides. And then I repaired that foot to the point where in 5 months, he was able to spin on that foot and win the California State Discus Championship, which is the hardest state in the nation to win a track championship in, by the way. And in 5 months to be able to do that on a Liz Frank repair that had 2 screws put in his foot. So you know how dramatic that injury is. That's usually 12 to 18 months. And so what turned me on to peptides, and peptides basically are chemicals that your body makes. Your body makes peptides. They're small chains of amino acids, smaller than a protein. All right. But they're signaling compounds that tell your body to do things, everything from releasing growth hormone to improving the way that you utilize your blood sugar to helping to repair your tissues to helping your immune system function better. And, it's a relatively new area of science ever since 1923 when insulin was invented, which is a peptide. So peptides have been around for a long time. But now people are starting to really come alive with them. Probably the most popular right now that everybody's talking about, Ozempic and Mounjaro, semaglutide and tirzepatide are peptides that are used to help people are using them, obviously, to shed that extra weight if their BMI is high enough and they qualify, or they're people with type 2 diabetes. They're using these peptides to help improve the quality of their life. And so peptides for me, I think is the next evolution of healthcare. Just like nutrients have value, just like ACE inhibitors and ARBs have value for blood pressure, just like any other kind of tool that we have. Peptides, I think, in the next decade are going to enjoy an incredible emergence into the value of healthcare because a lot of people they get better from them. Now, the biggest issue with peptides is that you've got people going online and buying peptides that are not for human use. I mean, they say not for human use, not even for animal use. So I always think if it's not for human use or animal use, why am I going to put that in me, right? Why would I buy that? Go to a physician who is trained, who is knowledgeable, so that they can utilize these peptides correctly and help someone to get the benefits that they can get from them.
Can people buy them? What is the basis behind that?
Oh, I mean, I think that once again, you got Dr. Google and you've got these internet mavens that have maybe read a study and haven't been around a lot of patients. I mean, I've been involved in probably over 100,000 patient life sessions in 40 years and then have taught and developed programs that have touched another million lives. So, I mean, I'm fairly familiar with what happens with people. And you want to have good guidance from physicians, me being a clinical pharmacist, board certified clinical nutritionist. I get the value of all of us as a team, but I think when people start to read something and they go, wow, I heard about BPC 157, which is a peptide that helps with inflammation. It was a peptide that I used for my son's foot. And, and then they go and they look online and they end up buying it online, and they have to sign a disclaimer that says, I am not going to use this for humans or animals. And yet they go ahead and they take it. Now, the problem with
Okay,
that is the quality could be suspect. And
absolutely.
that's
You need to make sure it's
that
pure. And
you need to make sure it's pure, it's safe, it's been filtered appropriately, because
correct.
even things like how the final step of filtering to make sure you don't get something in there called endotoxin.
Right.
Endotoxin would create, a reaction that could be incredibly harmful in an individual, right? And
Absolutely.
so I think that, you know, I love peptides. I love the responsible use of peptides. I like physicians and healthcare providers, like, pharmacists that are experts in, how they're being made, and how they can be applied. Yeah, utilizing this, emerging information. And then I think about all the other stuff that's out there, and that part does worry me. So I think if you're reading about peptides, if you're listening, I'm just telling you, I'm chair of the International Peptide Society. I train lots of docs and other healthcare providers, but mainly physicians. Make sure you go to you know, a licensed provider to get a peptide. Don't buy them on your own, and don't put things in your body that are said not for human use. It
Thank you for
just doesn't.
emphasizing that. Because I've had patients where I have prescribed peptides from a reputable pharmacy, and then they come back to me, well, I got it online a lot cheaper. And I was like, oh, no, 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 no. Tell me what website
Yeah,
it is. And I go to the website, I'm
right.
like, it says not for human use right here. Like, you're really taking that? Oh, and by the way, my blood pressure is a little high. What should I do about that? I'm like, you should stop taking a drug that you don't know what's in it. So,
Yeah,
scary.
exactly. So, I think the beauty of peptides, once again, is you're giving back your body
Right.
compounds that it should be making, but either because of age or injury or maybe infection or something has worn out your ability to make these compounds. And so now you're just replacing them, and you're helping your body to get back to that part that I like called homeostasis. It's
Absolutely.
back to balance. I'm keeping the inflammation at bay. I'm aging gracefully. And I'm also not using things to push my metabolism excessively, right?
For
So
sure.
it's not about whether we overcharge our body or we don't do anything. It's about how do we keep things in balance. And you want to have a team around you. I value good body workers. I mean, my people that do physical medicine that I've gone to over the years have been invaluable to me, just as a great dietitian, a great physician, and any of the team. That's how you really end up capturing the power of utilizing nutrients and peptides and
Right.
bioidentical hormones, and even medications, along with your lifestyle choices that you make.
Let's talk about some specific peptides. So you just already mentioned BPC 157, which we love for kind of sports injuries, healing from an inflamed tendon, or even gut health. We haven't really touched on gut health, and I know you're a big proponent of that, as are we
Yeah.
at Performance Pain and Sports Medicine. So let's get your take on it so people can understand from the expert.
Sure. Well, I mean, gut health is a huge thing. I mean, if you exercise regularly more than 30 minutes and it's pretty intense, chances are you're disrupting your gut. I just did a talk at the NBA Summit in front of all the teams. And that's the big thing I focused on, was realize that the harder you train, the more your gut gets broken down. And so the importance to that is that once it breaks down, you have to repair it. And so repairing your gut, peptides can be invaluable, like BPC 157, body protection compound. That's what that stands for, BPC. It's made in your gastric tissues and released to protect your mucosal barrier, or the one cell layer thick lining that protects your intestine from your bloodstream. That's how important it is to get that. So it helps to heal muscles and tendons. It helps with the GI tract. It's if people get cortisone shots, the big knock on that was it dries out the tendons or dries out the muscle tissue or ligaments. And here, when you use BPC with it, it's shown that it doesn't do that. There's
So
been great publications on that.
I'm sorry. Normally you say you take it for a month, right? When you're trying to heal, and then you stop it. Can you continually take it? or do you have to cycle it like some of the other peptides?
Yeah, there's no reason your body makes BPC, body protection compound, all the time. So if you want to take more, I don't see any real contraindication to it. If you're not need to, I would say cycle it. If you're training hard for something, maybe, or you're in that, like for me, I have periods where I'm training hard and periods when I'm training light. Maybe I add it in when I'm training harder to help, repair and
Right.
reduce the soreness and those kind of things, because it's good to think about cycling your peptides. We talked about BPC. Well, one of the other ones that's great for the gut is a compound called Larazotide. And Larazotide helps the tight junctions or the epithelial cells that they gap. And that's what creates what's called leaky gut. It
Right.
helps to get them to come back together so that now your gut's not leaky. It decreases something called zonulin in your body, because zonulin makes your tight junctions between your epithelial cells gap and get leaky. So Larazotide is good. And another one for pain, which is phenomenal, is one called KPV. And what's amazing about KPV is only 3 amino acids make up that peptide.
Wow.
Just 3 amino acids that make that peptide up. And it's a very strong inhibitor of a inflammatory compound called TNF alpha. So TNF alpha is a big deal. Like everybody, hey, a lot of the biologics that are used for autoimmune conditions
Right.
target limiting TNF alpha in KPV. When you take it, and I'll give that in combination with Larazotide, we'll give that to folks in a compounded oral capsule, and it'll help them with their chronic inflammatory response. And then you're also healing up the gut at the same time, and hopefully people are following a good anti-inflammatory diet. So
Right.
modified, low carb, low inflammatory, low allergen diet at the same time. So they're healing their gut, eating better, and utilizing something that'll kind of turn that signaling around.
For sure.
So that one is a great one for the gut. And then, of course, just make sure people are taking fiber and getting some probiotics in, because the fiber feeds the probiotics, and the probiotics get influenced by so many things, from stress to the way we eat. So that's kind of for the gut. I'll tell you one of my favorites, because I think a lot of people post pandemic still feel worn down, if they had COVID, for example. And it's in the literature, people that are still feeling tired from COVID, it's their mitochondria, which are the powerhouses of your cells, are just kind of lazy. They're not making energy. And
Right.
so you feel fatigued and you feel foggy headed. MOTSC, or mitochondrial derived peptide, is really good to kickstart the mitochondria to start making energy again. So people, start to feel like, hey, I'm making energy again. This is great. So that's another favorite of mine, that I think is great. Now that one's not oral. That one is one that,
Right.
doctor would
Injectable.
prescribe injection. Yep.
The other injectables, the semaglutide and tirzepatide you talked about that are the weight loss peptides, I feel like a lot of people are doing great on those because there's limited side effects, just maybe some mild nausea, maybe some constipation, but people do love how they feel. And then it kind of motivates them to then eat better and make the right choices. And it's a kind of a combination. And then you add in the BPC 157 because, they're doing the right things now and healing their gut as well.
I love those. I mean, I know there's a lot of negative publicity on them, but I think if all you do is take them and don't try to change your lifestyle, yeah, you're going to gain your weight back when you stop taking them. But if you really work on, hey, I'm going to use these peptides to manage my weight, reduce my appetite. Actually, they also protect your brain. There's a lot of evidence that semaglutide actually reduces something called microglial activation in your brain, which
Right.
is, kind of a neuroinflammatory signaling that happens. But I think if you use peptides like ipamorelin or BPC in combination with using your, semaglutide or tirzepatide, so you're helping your body stay anabolic. Maybe you're starting to exercise, starting to gain, and I totally agree with you. People get motivated when they start to lose weight and they feel better about themselves. Start to eat better, give them guidance on how to make better choices with their food. Now all of a
Absolutely.
sudden you are changing a lifestyle. So I'm not really hip to all the criticism that those are getting out there in the popular kind of social media, almost like it's kind of like an artificial torch that they're flaming to try to get attention. I've seen too many people getting benefit from it in real life, actually practicing, not just reading a paper.
Exactly. And of course, the negative publicity is like people's muscles are going to waste away. Well, you can't just sit on the couch and do this and just eat a cracker. You have to actually eat your protein, do your exercises, move around, the basics. So,
right. That's exactly right. And, I think that I don't know. It's once again, it's expecting it to be some sort of miracle instead of it being useful.
right.
And it's incredibly useful. Think of it. 50% of our US population is either diabetic or pre-diabetic.
I know.
And we're
It's scary.
40%. And in the next, I think, 6 years, I think it's 50% of our population is
Yep.
going to be obese.
I just decided to do my obesity board certification because this is a huge problem. Being in a pain practice, I was like, this is an epidemic. I need to be able to do something. So now I feel so much more comfortable with the science behind all these drugs and very comfortable helping people use the medication management to get to their goals. The other thing I do with some people, especially women are a little kind of, depends on how much weight they lift, but mostly men are very interested in the CJC 1295 with the ipamorelin for the anabolic effects. I tell people that, when they want to kind of change their body composition, obviously you have to continue to exercise and move your weights and progressive overload to see changes as well. But these peptides can help them, give them that edge. So I know you're supposed to cycle them. Can you tell people what the reasoning is and how often you can stay on it and how often you have to cycle?
Well, yeah, I mean, the big reason I think it works so well is when people get really stressed out, and a lot of people are, when the more cortisol you make, the more you shut down your growth hormone releasing hormone. So what ipamorelin and CJC does is it helps your body to say, hey, start releasing that again. So that's all it's doing. It's telling you to release it again. And it turns out that that's pretty anabolic for your tissues. And it's good to cycle it from the standpoint, and everybody's going to give you a different opinion on what the cycling time is on it. I will usually let people stay on it a good 4 or 5 months. Some people say, oh my gosh, it's got to be 8 weeks. I mean, I don't know. I've been using it 8 years now, and with folks and taught a lot of docs how to use it. And I haven't seen anything bad happen when people are on it for, 4 or 5 months, because it also helps do things like improve your circadian sleep rhythm as well. So I kind of like it for the generalized effect, in addition to the, lean mass, helps to stimulate you, improving your lean mass. So, 4 months on or so, take a month off, get back on. All you're doing is you're resensitizing your body's ability to utilize that peptide. But it's one of those things where I think it's mainly been brought up in the literature because when people were like doing, ergogenic aids, coming from the bodybuilding community, everybody talks about, cycling. You've got to cycle. And I think it is good to cycle it just to give your body a little bit of break from it. But I don't think it has to be as dramatic as, 8 weeks on, 4 weeks off. It's kind of a little bit of that what I call meathead myth.
Right.
Did I say that?
Absolutely.
I can say it because I was one. I qualified for the U.S. Nationals. I was a bodybuilder when I was young. So I mean, I'm a part of the crowd. So, but it's that thing of, we need to cycle them. Now, I do believe that cycling peptides with seasons makes sense. I think that, doing a cycle of peptides where you're trying to help your immune system for a period of time, maybe
Right.
going into the winter months, might not be a bad idea. Maybe with spring, you start to use a little more melanotan to help with, tanning for one, but the immune system as well, where you're helping your melanocortin system to kind of come to life. And then utilizing these other agents like, ipamorelin and CJC to help keep our lean mass. I mean, look, I always say, muscle is the currency of aging, right? I mean, as you're aging, the more muscle you can hold on to, the more stable you're going to be. You're not going to hit that step and be unstable and fall and break a hip or hit your head, right? Either one of them are drastic consequences the older we get. And
Exactly.
so I think that's why I think I love ipamorelin and CJC because of that. And PEG MGF, if you're talking about muscle mass, pegylated mechanical growth factor, PEG MGF, is a great thing to combine with that in terms of, getting some muscle,
Wow. Thank you, Jim. I really appreciate you being here with us today. We could talk for like 3 more hours. This can go on and on and on.
Yeah,
So
oh,
fun.
it's great. I love it. Thanks for having me.
Yeah, Can't wait to potentially have you on again. So really, we appreciate your time. Thank you for being here with us today and hope to talk to you soon.
All right. Thank you for having me. Have a great day.
You too. We'll be back with a commercial break. This is Dr. Suzanne Manzi with Pain Diaries here in Houston, Texas.